So, good morning, Miss. My name is Hanifah Magarang from BSN-1 Section B. So, today we will be assessing the head, face, and neck. So, first is we wash our hands. But since we already washed our hands, we're going to explain and identify to the patient about the procedure that we are about to do. So, good morning, ma'am. May I know what's your name?
I am Princess Aya.
What is your age po?
19.
Your birthday po?
April 30.
So next is we ask the patient to sit upright, ask patient to remove hairpiece, wig, accessories, and then examines the posterior, lateral, and interior skull and scalp. Miss, can you please remove your earrings or any accessories you have on? So next is we inspect and palpate the skull for size, shape, and position. So note we size in proportion to overall body size and avoid shape. The next is we assess trigeminal and facial nerves. Instruct patient to clench teeth while examining. While examiner palpates muscles over jaw. And then instruct patient to raise eyebrows, close eyes slightly, frown, smile, or puff out their cheeks. Dito sa next. Ma'am, can you please clench your teeth? Next, ma'am, can you please raise your eyebrows? Can you close your eyes tightly? Can you frown? Smile? Ma'am, can you puff out your cheeks? Can you show your teeth? Next is we assess temporomandibular joint just in front of each ear for crepitation, range of motion, and tenderness of palpation. Next is we instruct the patient to shrug shoulders against resistance of examiner's hand. Shrug din mo shoulder. Taas ka ba? Baba. So next is we inspect the neck for symmetry, masses, scars, and movement. We have patient extend neck with chin pointing towards the ceiling without tensing neck muscles, then palpate using pads of finger. Ma'am, can you please extend your neck and stare at the ceiling? Taas ko pa. Next is have patient bend neck laterally with ear towards shoulder, then rotate with chin towards shoulders, right and left. Another. Isa pa. Assess lymph nodes. Inspect both sides of neck slightly forward. Palpate each lymph node chain systematically. Use rotary motion. And be sure to add pressure in underlying tissue. Note size, shape, location, and mobility of the neck. Assess thyroid. Stand in front of patient, inspect the lower neck overlying the thyroid gland for symmetry. Provide client with a glass of water and ask client to extend neck and take a sip of water. Note any bulging, and then use light, gentle palpation, allowing fingers to drift on the gland. Next is assessing nose, sinuses, and mouth. Examine nose and sinuses. Inspect nose externally for placement, alignment, and symmetry. Palpate more gentle if swelling exists. Place fingers on the side of client's nose and occlude one nostril while client breathes with mouth closed, then repeat. Use pen light to eliminate anterior nares and inspect nasal mucosa and position of septum at an interior and nose. Inspect for exhalation or sloughing. Ask client to tip their head slightly. Inspect septum, percuss and palpate frontal sinus over bridge and upper orbit of the eyes. Us. Assess hearing acuity. Ask client to remove hearing aid and close eyes. Test one ear at a time. Stand 15 to 60 centimeters away or 6 to 2 feet away. Exhale fully and softly and whisper a sequence of numbers. Ask client to repeat in conversational tones. If hearing loss is suspected, perform a turning fork test. Hold fork at its base and tap lightly against heel of palm. Place base vibrating fork on middle vertex of client's head or middle of forehead. Ask client if sound is heard equally in both ears or better in one ear. Rin test. Place stem of vibrating turning fork against client's mastoid process. Ask client to tell you when sound is no longer heard and observe the length in seconds. Ask clients to tell you when sound is no longer heard. Again, time with a watch. Compare the numbers of seconds for bass conduction versus air conduction.
Six, seven.
Examine mouth. Have client open mouth halfway and inspect for color, texture, hydration, and lesions. Inspect inner mucosa by gently pulling lower than upper lip from teeth. Note the color, texture, hydration, and any ulcers, abrasions, or cysts. Palpate cheeks with one fingers along the inner mucosa and thumb along outside the cheek. If lesions are present, palpate with fingers for tenderness and consistency. Palpate gums gently with palpate tongues gently with tongue blade and note persistences. Assessing the eyes and the ears. If client wears glasses or contact lenses, ask to read print while wearing the glasses. Note the distance as well. If client is unable to see print clearly, test each eye separately by placing index card over one eye at a time. Test visual fields. Have clients sit or stand 60 centimeters or 2 feet away and face you. Your eyes should be at eye level of client. Fully extend the arms midway between client and yourself. Then make it centrally with fingers moving. Move fingers or objects. It could stand from you and client outside of own field. Ask client to state when it is first seen. Test pupillary reflexes. Dim room lights to test the reaction to light. Ask client to look straight ahead. Move light source from side to side, face and direct light into pupils. Observe responses of both eyes. Normal pupils are round and equal in size, with a brisk response. Then lastly is test accommodation.
My sister is pretty. My sister is pretty.
Next,
My sister is pretty.
can you see? Dili?
Dili.
Can you see?
Oh,
Can you see?
natural.
Sige. So, assessing of breast. Palpation of breast. If client has lumps, examine opposite breast. First, client position their hand place below their head and into their shoulder. Nurse can ask client to demonstrate, or nurse can perform and teach client the procedures. So today I will be teaching the client the demonstration. We'll ask the client to move their hand up and to their other shoulder, resting to the tip of our shoulder, with our other hand ready to palpate our breast. So first is we're going to touch our armpit. And also we have 3 ways of palpating. We have circular, wedge, and vertical. So firstly is we're going to do the circular. So we're going to ask the patient to move their hands starting from the armpit to circularly in their breast, all the way up to their nipple, and then pinch. Again, we also have to touch every part of our breast to make sure that we don't miss anything. And then again, pinch. Then next is we have wedge. So we start from here, in here, and then pinch. And then next is we have vertical. Again, and then pinch. And then we do the same procedure and demonstration to our other breast.